I heard there are many techniques of doing lipo. So can you please explain more about it, doctor?
Yeah, liposuction initially started off with technique using suction. So when the word liposuction means removal of fat using suction. Okay. So the first and ever technique is using suction machine to generate vacuum to negative pressure to suck the fat cells from the body. So that's the first technique of using doing liposuction using suction method. The next technique is using vibration assisted or motor assisted, whereby the cannula which we introduce into the skin vibrates and shakes the fat to get it loose, and then we suck the fat using suction as well.
All right.
So this technique is called vibration assisted or motor assisted liposuction. The next technique would be ultrasound waves which generate heat. They melt the fat and remove the fat cells. This is ultrasound assisted liposuction. Okay. The next technique is using water assisted liposuction. So water is used to spray under the skin to loosen the fat cells, and using suction to remove the fat cells using suction. So this is water assisted liposuction. Another technique is using laser.
Okay.
So laser basically goes under the skin and melts the fat cells, and we need to use suction also to use. So we use different techniques to assist the breakdown of fat cells under the skin, being either using the suction, the vibration, the water, or the ultrasound waves, or the laser.
So 5 techniques.
Yes.
5 techniques. So depending after the consultation, then you will determine which procedure suitable
Yes.
for the patients.
Yes, but most of the surgeons have more or less their preferred technique, which we tend to use most of the time. There are few surgeons who use more than one or two techniques,
Okay.
but majority of them would preferably stick to one technique and use that for their liposuction. But of course, you can combine more than one or two techniques for the same patient as well.
I see. Oh, it doesn't mean that they have to pilih yang mana satu lah. That is depending on the doctor.
Usually depend on the surgeon.
Okay.
Surgeon's preference is there, but sometimes patient also will ask for certain particular technique.
Oh, when they ask, it means they've already done their research or something.
Yes,
So they ask more.
yes.
Yeah.
Because nowadays every patient already do their Google search and then
Yes,
come
of
to the
course.
doctor to ask. They already know what they want. So that's how the trend nowadays. We get patients who already kind of done their research and find out what the technique they like and prefer, and they will go to that particular surgeon who does that particular technique.
Oh, okay.
Yeah, like for example, somebody is doing ultrasound assisted lipo. He's already well known in the community,
Okay.
and they will go looking after that person.
I see. How about yourself, doctor? Which
For
which
me,
technique that do you prefer?
I've tried out most of the techniques available in the market, but I tend to stick on to one technique, because if you stick to one technique, you tend to master it in a long period of time. So I've been started off using the suction assisted, but then it was a little bit more painful and more traumatic to the patients. So then I moved to the water assisted liposuction, which is gentle, effective, and safe. Because any procedure which we do for patients, safety is the utmost priority.
Okay.
All right. So we need to use a technique which is safe and effective.
This is the one that I heard you talking at AMSC last July.
Yes. So I've been practicing the water assisted liposuction for all these more than 15 years now.
I see. All right. So he's the one to look if you into that technique. Okay, that particular technique. Thank you, doctor.